So hello, and thank you for joining us for our Feed, Read, and Grow Lactation Educational Series. I'm Sheila Umberger, and I'm the director of the Roanoke City Public Libraries, and I'm joined today by pediatrician and lactation consultant here in Roanoke, Virginia, Dr. Cameron Johnson. So this week, Dr. Johnson and I are focusing on digestive tips for your baby. So, Dr. Johnson, could you share with us what might be some signs to look for if your baby is having tummy issues?
Oh, the tummy issues. The first thing that's important to know is that the process of filling the belly with good bacteria is a normal one. Babies are born with very little bacteria in their stomach, and over time they acquire that bacteria. And that bacteria comes from the air that we breathe, it comes from our skin, it comes from the food that they eat. And they typically do get gassier between the 3 to 4 week mark, and it can really cause a lot of distress both to the baby as well as to parents who are trying to give them some comfort. The gas, while it's annoying, it's not harmful to them, but there are some things that we should be watching for to make sure that babies are doing well and managing that well. One of the big things that they do is they spit up. And there's babies spit up, and it can be something that is just normal and not cause any problems. The thing that we really are watching for is to see if they're uncomfortable when they spit up. So babies that spit up either a little or a large volume and don't care in the slightest spit, we call that a laundry problem, not a baby problem. The other thing that can sometimes be distressing for parents is when babies are having trouble going to the bathroom. Their poops or their stools are supposed to be nice and soft, almost pudding or applesauce texture, and can pretty much be any color under the sun, with the exception of if it's white, black, or red. If the stool is really mucusy, so it looks like there's like shiny, stringy things in it, that's something that you need to talk to your healthcare provider about, because that can really cause some issues. So the burping, the gas, and the stooling are what we're watching for to see if the babies are having trouble with digestion.
So you talk about burping. So can you show us some different techniques that parents can use to burp their baby?
Absolutely. This is one question that people ask me a lot. The first one that I like is to be able to take the baby and kind of sit them on my lap and holding their neck and supporting their neck, not by touching anything other than their jaw. And then what you can do is kind of rock the baby forward and backwards. And really what you're doing is trying to kind of maneuver that air bubble to go into a different spot so that they can clear it a little bit easier. Some parents will like to do a little bit of a modified version of that, where they kind of put the baby with their legs on their lap. And again, supporting the baby's neck is the most important part. And you don't have to tap them. You can just rotate your hand on their back. And sometimes this position is a nice way to kind of maneuver that air bubble around. Some parents like to pat, that's fine, it's just gentle, and you can always put the baby up on your shoulder, again, just supporting the neck in the most comfortable position for everyone. Sometimes a nice way to manage that gas is by having the baby kind of sit in that football position. A lot of parents like this one because they can then have a free hand, and the baby is being supported again by their jaw, where you're supporting their neck but not touching the neck at all. And the nice part about this one is that the belly has pressure on your arm, and that helps the air to rise to the back. So whether it's in this football position or the baby is on your lap again, you can tap gently, and that kind of shakes all of the air up to the back of the body, which is where the rectum sits, and allows the baby to pass that gas a little bit easier. This is a nice one, and sometimes babies that have that big belly because there's a lot of gas feel very comfortable in that position and will calm down nicely.
So thank you for showing those burping techniques. Are there other exercises that a parent can do with their baby to also help ease their gas pains? You mentioned the one. Are there other things that they can do to help with that?
Yeah, there's a couple things that you can do. My favorite is putting them on their belly.
Yeah.
Because it gives a little bit of pressure on their belly. But lots of parents will do almost a bicycle where they take the baby's legs and kind of rotate them around, and sometimes that helps to alleviate some of the gas as well. Some parents will just do this gentle massage on the belly, and you're kind of going in a clockwise formation, because that's the way that the gut moves. So you can help to stimulate the motion of the gut with this gentle massage. And babies love that too.
That's always nice too. It's kind of a bonding moment as
Yes,
well, right?
for sure.
Well, thank you so much for being such an incredible resource for our families. These are all just super helpful, and we just want to thank you for joining us in our talk today.
It's my pleasure.
Thank you.